yet. That's it. Enjoy.
Thomas, thank you very much.
9:15, final weekend before almost all legal restrictions around COVID are lifted in England. But after more than 50,000 cases of the virus were recorded yesterday, some people are arguing it's too soon for them to be lifted.
Let's talk about this and all the other developments as well to do with the pandemic. As usual, Professor Linda Bauld and Dr. Chris Smith are with us. Good morning to both of you.
Morning.
Now, we have spoken over the months at various different times of great importance. And everybody knows the rate of infection is going up. I think what you see when you see the easing and the figures.
Good morning, Charlie. When the Prime Minister announced that July the 19th was roughly the date for opening up and removing all restrictions, that was around the middle of June, and the rate of infection has increased fourfold from then. So we are in quite a different place from where we were when that decision was taken. And what we're seeing around the UK is that for the first time since the spring, early spring, we've got 1% of the UK population, roughly from the ONS infection survey, who would have had COVID-19 in the week up to the 10th of July. Those are big numbers. We're getting around 700 people a day admitted to hospital at the moment. And the projections of how they could go are quite alarming. So it's not the situation we wanted to be in. We didn't want to be opening up really in quite a dramatic way at a time when we have so many infections. And that's why you're hearing many people expressing concern.
Chris, where are you on this?
In the position where I expected we would be in terms of when we open things up, we get more meetings between people going about their business. That's translating into more cases. We knew that would happen. But what we're not seeing, and this is the reassuring bit, is that they're not translating at the moment into casualties. We've been very, very significantly weakened by vaccination. Nearly 90% of UK adults have had their first dose of the vaccine, and nearly 68% of UK adults have had 2 doses of the vaccine. If that status quo is maintained, and we do see very low levels of people who become severely unwell and end up in hospital and regrettably pass away, if it stays really low, then we're going to be okay. It needs to bear fruit.
Chris, question for you from Sheena. Sheena's on the new mutations occurring, if they are, and effectiveness of the vaccine.
Because of genetic spelling mistakes that creep into the genetic code as a thing replicates itself. And occasionally one will emerge which is better than all the others. And it's a bit like putting a bigger engine in your race car. It will have an advantage in the race, and it will then push out of the way all of the other cars in the race. Where we're reading the genetic code of the cases that we are diagnosing, because whenever someone has a positive coronavirus test, we take a sample of that test that's run up a positive, and we read the genetic code of so that we can change tack accordingly. And this does work. It helped warn us and give us forewarning about what the Kent variant, Alpha, was subsequently going to do last winter. And that certainly helped us to tackle that more effectively than we would have done had we not known about it.
Linda, it's interesting, isn't it? Because obviously we've been reporting.
Then we're going to be okay. If we do see a big uptick in people going into hospital, but the number of people who are coming in and staying in is lower. People are staying in for less long, and then they're recovering and getting off home. So we have changed the course of the outbreak. We have changed the dynamics of the disease with the vaccination. Let's hope that the continued drive to vaccinate more people with Grab a Jab weekend and so on continues to bear fruit.
Impact on the new mutations occurring, if they are, and effectiveness of the vaccine.
And that just happens. Most of the time it happens and it disables viruses, or it disables things, makes them less reproductively fit. They don't actually spread as well, which is better than all the others. And it's a bit like putting a bigger engine in your race car. The likelihood there is that you're going to disclose more of these sorts of variants. So there is a game of cat and mouse going on between cases and those sorts of consequences. What we're hoping is that with the surveillance we have in the country, where we're reading the genetic code of the cases that we are diagnosing, because whenever someone has a positive coronavirus test, we take a sample of that test that's run up a positive, and we read the genetic code of the virus. And that's was subsequently going to do last winter. And that certainly helped us to tackle that more effectively than we would have done had we not known about it.
Linda, it's interesting, isn't it? Because obviously we've been reporting the news that the beta variant, which, and in terms of the message that we're hearing, it's almost like the Delta variant was the one we should be concerned about, and the beta, the vaccines we've had are effective against that. So how do we balance what we're hearing?
It's difficult, isn't it, Naga? So this variant, the beta variant, we've had in the UK actually for quite some time. Public Health England produces a report, a technical briefing every week, as Chris and I have discussed many times before, are still effective in the face of all the variants we know about, but they may be slightly less effective. And there certainly are a couple of studies with this variant that was initially picked up in South Africa that suggests it may challenge vaccines. What I would say about travel restrictions is they certainly can have an impact. We can see that internationally. But I guess the question is, how long will they be effective for? And also, even if we get more cases of this variant in the UK, how will it respond in relation to Delta? Because sometimes, Delta has become such a dominant variant because of transmissibility. So there's lots of questions about this, but it's a precautionary move on the part of the UK government.
Linda, a positive COVID test, had been double vaccinated.
This is a really important question for Maggie, and something I think actually I was discussing with a family member the other day. And about 100, and I've got the figures here, about 118 people from that group of people who sadly died with this disease had both doses of the vaccine. So that's 46% of cases. Now that sounds terrifying, doesn't it? Why would 46% of cases of people die in our hospitals who've had both doses of the vaccine in that period? The risk of becoming unwell and going into hospital, we know that's far, far greater for people who haven't had the vaccines. And for everybody who hasn't had vaccines, the risk of mortality is obviously greater than if they had been vaccinated. But we'll still see deaths with people, sadly, who've had both doses. We always knew that would be the case.
Chris, often our questions are just very... She'd like to know, can packaging left for a few hours still pose a risk for a fully vaccinated person?
Come along and you touch it, you've got to pick up an infectious dose, and then you've got to transfer into a vulnerable part of your body an infectious dose, whether that's into your mouth, your nose, or your eyes. They're all connected. Really, we understand this is a respiratory infection. Most of the transmissions are occurring through things carried through the air and people breathing in that infectious dose. So the chances really of you touching an infectious dose from a package left on your doorstep, unless you're going to eat the package, I think the likelihood is, and I suppose people do have meals delivered that way, don't they? But you don't normally eat the packaging, although in some fast food outlets I've dined in, actually the packaging was probably more nutritious than what was. That's the thing to watch out for. Avoid crowded spaces, avoid people who are infectious if you can, who have symptoms. Wash your hands, because you're adding a little bit to the equation, but really it's not the dominant way in which you're going to get exposed, so I wouldn't worry about it.
Got to say to both of you, we're not going to see you for 3 weeks because obviously the Olympics are on. So we're not going to have the COVID panel, so we thought we'd inform everyone of that. How are you both planning to spend your time? And thank you, Linda, for the flowers, because they've brought a lot of joy this morning. How are you going to spend the next 3 weeks?
Well, the weather is fantastic, even here in Edinburgh, Naga. I'm sure you've seen the forecast, haven't you? So hopefully we'll all be getting outside. We have to check in with Chris, though, to find out how the tractor race went last week. Haven't heard the latest on it.
Did you win, Chris?
Oh, yeah. Well, it was going really well until I got a flat tyre. And I got a flat tyre about a mile or so from Barrington, where we'd told everyone to be. So unfortunately, I was a bit late. It took me half an hour. Luckily, there was a very nice guy who came along, and he managed to get the tube out of the front wheel of this tractor, because a piece of metal on the road had just gone straight through it. And we did a roadside wheel repair on this tractor and got me going again, but it took me a little while to catch up. And it was great fun. It was absolutely brilliant, and we raised a lot of money. So thank you very much indeed to everyone who came along and supported and hung around at Barrington to give us a wave when we finally got through there. But no, more than 100 tractors took part. 33-mile loop. We made it, and it was great fun, and the weather held as well. So thank you for asking, and thank you very much to everyone who came and supported, and those who came and said hello too. It was lovely to see you.
What colour was the tractor?
Blue.
It was a blue tractor. That's right.
Nice.
It's Ford's original colours. Ford Empire Blue is the official paint name of that generation of tractors.
It was very nice you thanking everyone, because I know Linda turned you down flat for going to see it.
Yeah, Linda missed out big time. You should have come, Linda. We had the party trailer, which there were people who told. One group had a trailer that had a sofa in it. They really knew how to do this in style. They had a sofa in their trailer with champagne. The only thing they didn't have was a television. I was really quite surprised. It was amazing. I now know how to do this properly next time.
Well, I've got 3 weeks maybe to develop an unusual hobby of my own, so we'll check in on that when we get get back.
Well, we look forward to seeing you both again as soon as it happens. Have a nice few weeks in the meantime. Good to catch up. Thank you.
Thanks. Bye-bye.
Bye. Matt Tebbutt's taking over in the Saturday Kitchen.
Peanut and chili oil sauce with a fresh red cabbage pickle over the top.
Very nice. See you later.
Let's see, time now is 9:31. Secrets of the London Underground starts on Monday, the 19th of July, 8 p.m. on Yesterday. That's all from us this morning. Of course, breakfast back tomorrow at 6 a.m.
Radio 2.
Mary is enjoying timeless recipes.
Finger and say, well, how that's rubbish, isn't it? There's a kind of honesty thing that only goes so far.
And likewise with the media, if the thing that wasn't going to be picked out was the one sentence where you said, oh, you know, we got it wrong. You know, minister got it wrong. You know, so the reality, the whole ecosystem creates a system where people opt out. And what I'm trying to, because people go, oh, you're all the same. And the idea that I am the same as like Boris Johnson or Jacob Rees-Mogg, it's provably untrue. But the fact of the matter is the whole system is set up to sort of fall down. And then the people who opt out are the people whose lives it changes. And that's what upsets me. And that's what I'd like to change.
It's an interesting read. Thank you, Jess. No doubt we'll speak again soon. You look after yourself. Take care. Jess's book is called Everything You Really Need to Know About Politics. Headlines are coming up.
Don't let gravity hold.
And really, we will just have to pick up the pieces and deal with it and, you know, help our clients through this pretty terrible situation.
Do you have any idea of the kind of numbers of people, of people who either have already gone to France, who'll be caught up in this, or who were planning to go to France, whose plans will have to change? Have you got any ideas of numbers?
We're talking hundreds of thousands of people, because obviously 10 days ago, you know, the consumers were told that, yes, if you've been double vaccinated, France was one of the countries that you were able to return to and you didn't have to self-isolate or take the additional test. So effectively, double vaccinated meant the same as green if you were traveling to an amber destination. So there will be huge amounts of people that have put off their holidays year upon year, and not forgetting the amount of people that are absolutely desperate to see family members who have been waiting for the opportunity like this from Monday, as they expected, to be able to do that. And so, you know, we mustn't forget that this is not just about traveling for leisure purposes. This is also about reuniting families who, again, will now have to wait months, possibly longer, before they can do so in a way that is free for them to return, not have to self-isolate.
See you shortly.
Friday across the BBC.